Patient in London could be the second person ever cured of HIV. In 2 cases, patients were treated with a stem cell transplant from donors who carry a rare genetic mutation. Joining us now from New York is Eric Sawyer. Eric is living with HIV and is one of the longest-term survivors of the disease. Welcome. This week, you wrote an article for Salon.com saying, we quote, shouldn't believe the hype. Kind of elaborate on that for us, Eric. Why not?
Well, this reminds me a lot of 1996 when the protease inhibitor drugs were first released and the concept of triple therapy with 3 HIV drugs, the AIDS cocktail, came on the market. And everybody immediately said, oh, the cure is here, the cure here is here. And this is very similar, but just like the protease inhibitors and the cocktail were not a cure for AIDS, this isn't either. And there's four primary reasons. One is extremely dangerous. People often die of bone marrow transplants. 2, it's not scalable. You don't do a bone marrow transplant with anybody just because they have HIV. All the cases that they've done this on are people who are co-infected with cancer and are in fact in end-stage cancer that has failed all traditional forms of treatment. It's not sustainable. The bone marrow transplant has to be with stem cells from someone, as you said, who has the CCR5 genetic mutation that makes it impossible for them to be infected with HIV. And the process is extremely expensive. You have to delete the bone marrow and the immune system of the individual through radiation. You then have to find, mine, and implant this genetic mutated resistant bone marrow. You have to follow to make sure that there isn't host-donor rejection reaction that kills patients. And then you have to test to see whether or not the bone marrow and the immune system are reconstituted in a manner in which the patient is HIV resistant.
And it sounds like a lot, you know. Is this more overwhelming and doing more harm than good from a psychological standpoint or even physically on your body?
Well, you know, it's certainly very dangerous. The first individual, the Berlin patient that underwent this procedure, almost died from the host-donor reaction. Many of the subsequent patients, and there have been a number of patients who have undergone this procedure, died. And so, you know, we have 2 cases here in a dozen or so years, and there's all this hype about it. It's understandable because, you know, 36 million people died of AIDS. There's estimated to be a similar number living with HIV around the world, so the world is desperate for a cure. It's important that additional information has come forward that may guide future research on how we might get a cure, but it would be much better if the media were focusing on the need for people to get an HIV test, to know their status. If they're positive, immediately go on HIV medications, because that not only extends their lives, but makes them unable to pass the HIV virus on to other people.
Eric Sawyer, thank you so much.